Today we speak not only about a genocide, but also a meticide, the systematic targeting, detention, and abuse of doctors, nurses, and paramedics whose only mission is to save lives. Instead of sharing statistics with you, I will be sharing some first-hand testimonies. I will warn you, they are very difficult to hear, and yet they only catch a tiny glimmer of what detained Palestinians, including mothers, daughters, children, healthcare workers, fathers, and sons experience regularly in Israeli detention centers. Ziad, a nurse who worked at Al-Shifa Hospital, described what happened when Gaza's healthcare system collapsed under both Israeli sieges on the hospital. He said, "One of the most difficult things was being a healthcare worker and not being able to help your patients who were suffering and dying. He watched maggots crawl out of wounds and dead bodies because the Israeli military prevented them from treating patients and burying the dead." Ziad was also taken hostage both times and tortured. He said, quote, "I spent 25 years building a life and now suffer from PTSD, live in a tent as a refugee, and I've lost 2 of my children to this genocide." He asks, what are our faults as medical staff and patients to disturb this inhumane treatment? Dr. Mohammed Abu Salmiya, director of Al-Shifa Hospital, described months of detention after being seized in December of 2023. He said, "Many days I was tied to a chair in the interrogation room for more than 15 hours. I was not allowed to sleep, eat, or drink." He continued, "Frankly, no matter how long I talk about what I experienced in detention, it is only a fraction of what truly happened. I am talking about being clubbed, being beaten with rifle butts, and being attacked by dogs. It's terrifying. All night you hear the voices of people around you screaming. I saw people who were dying there." Another witness, paramedic Bashir Abu Mustafa, detained after the attack on Nasser Hospital, reported being blindfolded and zip-tied daily for 51 days, beaten severely enough to fracture his ribs, denied water, and subjugated to degrading abuse. He stated that he underwent surgery without consent while restrained to a bed and continues to suffer neurologic damage and chronic pain. Another detainee describes what was done to a paramedic he met in Naqab. "One guy was bleeding from his private area from behind, and he told me what they did to him. He told me 3 soldiers put an M16 in his private areas. I heard this directly from him. He was terrified. First they put the M16 and then they took turns, the 3 of them raping him. I saw him bleeding with my own eyes from his bottom. His mental health was terrible. I don't think he told anyone. He started talking to himself in prison. No one knew about him, but he spoke to me." Dr. Issam Abu Ajwa, general surgeon from Al-Ahli Arab Hospital, stated that after months in detention, they transferred me to Negev prison in the desert. It was summer and very hot. We could only drink hot water from the pipes once a day. We didn't have shoes, and they would make us stand on the asphalt with bare feet for 2 or 3 hours in 99 degrees Fahrenheit heat. I lost half my body weight. They never charged me with anything, and I didn't get to see a lawyer during 7 months of imprisonment. International humanitarian law is clear. Hospitals, patients, and medical personnel must be protected. Healthcare workers are not combatants. Treating the wounded is not a crime. Today we call for the immediate protection and release of detained healthcare workers, independent international investigations into abuses in detention facilities, and the restoration of medical access for civilians in Gaza. Silence in the face of these testimonies is complicity by global governments, fellow healthcare workers, and our healthcare institutions and organizations like the American Medical Association, the American Academy of Family Practice, and the American Academy of Pediatrics. Thank you.